Hi everyone, my name is Chris, and this is my video discussion post for week 7. For this week's discussion, I chose to research Indigenous Americans. According to our book by Hayes and Erford 2018, one social issue that many Indigenous Americans face is growing up in communities with lower rates of educational achievement, leading to higher rates of unemployment and poverty. The high school dropout rate for Indigenous Americans exceeds 60% in many areas, and the unemployment rate is 3 to 11% more than the general population. Even though it is typical for Native Americans to live in multi-generational families as part of their collectivist cultural identity, many also do not have a choice. The historical and ongoing oppression of Indigenous Americans has led to familial poverty, lack of adequate housing, and higher rates of incarceration. I was astonished to discover that the arrest rates for Indigenous Americans are 3 times those of African Americans. Another social issue is overall poor physical and mental health and low life expectancy of Indigenous Americans. According to an article I found by Jean et al. 2023, individual and communal experiences of perceived, vicarious, and experienced racism can lead to racial trauma and psychological harm. Symptoms include nightmares, headaches, flashbacks, avoidance, and hypervigilance. This can further lead to physical health complications like increased risk of diabetes and hypertension. Therefore, the average life expectancy of an Indigenous American is almost 5.5 years less than the U.S. population. While the median age of the U.S. population is 38 years, it is only 29 for Indigenous Americans living on reservations. Even though the harmful effects and symptoms of racial trauma are similar to post-traumatic stress disorder, PTSD, racial trauma is not included in the Diagnostic and Statistical Manual of Mental Disorders 5th edition, DSM-5, or recognized as an official mental health diagnosis. This is because the medicalization of mental health has shifted focus on primarily the biological causes of mental health disorders, dismissing any potential social roots. The lack of formal recognition impacts funding for research, insurance reimbursement, and access to other resources. However, there have been efforts to improve the health of Indigenous Americans through the Tribal Practices for Wellness in Indian Country, urban Indian health centers, cultural immersion and language immersion schools, culturally based suicide and substance use prevention programs, tradition-based programs, and so on. Also, there is encouragement for the preservation of tribal languages, stories, and participation in traditional ceremonies that help Indigenous Americans gain a sense of belonging and identity. Even though we often turn to cognitive behavioral therapy, cognitive processing therapy, and mindfulness for depressive, anxious, and PTSD related symptoms, the article I read further recommends keeping radical healing in mind therapeutic approach, which is a strength-based theory, culturally competent approach that helps Indigenous Americans process the impact of oppression while also cultivating hope and supporting liberation. This theory allows a collaboration that is similar to Indigenous Americans' views. After all, their insights and awareness about their lives should be incorporated into their treatment. Furthermore, it is important that we, the counselors, focus on their mental health symptoms as well as process the impact of racial trauma. Having the client identify when they experience symptoms or identify critical incidents that have been traumatic can help reveal if they are experiencing these symptoms due to racial trauma. This way, they can properly identify how some systems of oppression have contributed to their experiences of racism and marginalization, hopefully decreasing their feelings of guilt and self-blame. This can help them resist these oppressive systems, develop empowerment and appropriate coping skills, foster hope, and promote healing. One primary cultural barrier for Indigenous Americans seeking counseling services is trust versus mistrust. With their previous historical and political history, They may have difficulties forming trust with the counselor or someone outside of their tribe or nation. A way to mitigate this is to check in with any personal bias I may have, working with the client without realizing and keeping this in check. I should also ask the client to tell me about themselves through non-threatening narrative questions. For example, who they are, including culturally and spiritually, about their family, about their tribe or nation, and their life as they see it. It is important to know their level of enculturation or their specific practice of the culture, values, and behaviors of their tribe or community. This way, they can metaphorically draw me a picture of who they are as a person, which can help me understand them better and how we can work together, as well as help build rapport and a stronger therapeutic relationship. I should further research their histories and the current realities of the Indigenous Americans who live in my geographical area so that I can better serve them. Another cultural barrier may be how they approach their boundaries. For example, not shaking hands and too strong of eye contact can be seen as disrespectful. Hospitality, space, silence, and collaboration are important to them. The best way to mitigate any potential disrespect is to be honest and ask them about their preferred communication style and not make any assumptions. The best way is to let them take the lead and allow them to identify their preferences while also keeping these potential preferences in mind. Only offering a handshake if it is their preference and meeting their level of eye contact. It is professional courtesy to offer them a beverage, a snack, or if I could get them anything. This is something I already do for my clients in my groups to help them be more at ease. I will also let them guide me with how much space they need and allow them silence, especially in the beginning if it increases their comfort level. I can offer suggestions without guiding clients to specific choices. This way, I give them tools for their toolbox, but also the autonomy to do what is best for them. Also, Indigenous Americans make decisions on what is the best for the collective, not an individual, something else to keep in mind. If survivors of racial trauma reach out for help, they need adequate support and guidance to prevent them from experiencing any further racial trauma. Thank you for listening to my discussion post this week. I hope you have a great rest of your week.